This week's program was filmed at Medical City, Dallas. Founded in 1974, Medical City is recognized for its state-of-the-art medical facilities and commitment to excellence in patient care. Located in Dallas, Texas, the hospital's medical team consists of more than 1,150 physicians, many of whom are recognized as the world's best in their specialties. Medical City, specialists in life. Welcome to Platforms, the life-lifting news program for women. Now, here's your host, Siobhan Palmer.
Hey, welcome back everybody to Platforms, the life-lifting news program for women. We're continuing our conversation today with Dr. Joseph Kuhn. He is one of the top bariatric surgeons in the state of Texas. This is a very, very timely topic about the growing obesity rate in the United States and worldwide, frankly. Dr. Kuhn, when we went to break, we had just covered gastric bypass surgery, and now I want to go into the lap band surgery. Would you hear more and more about this procedure? So what is the difference between a lap band surgery and the gastric bypass?
Well, the lap band surgery has been around for at least 10 years. Started in Europe and Australia, and it's been active in America for 6 or 7 years.
Very popular, yeah.
So it is a plastic or silastic band, like a balloon, that sits around the upper stomach. And we fill it with fluid. And as that tightens, it restricts the flow of food as it goes down through the stomach. So it creates a small pouch above that balloon. So imagine that you're eating a sandwich.
Right.
You'll have a bite, it goes down, you feel it get held up in that upper pouch, and then it slowly passes through.
Okay.
So again, it works by restricting the flow of food, and it creates a small pouch. It's adjustable in the sense that we can add fluid, we can tighten it.
Right.
And so our goal is to reach the zone of tightness so that when you eat, you do feel restriction with most every bite of solid food.
Interesting. Now, I understand I had a friend who had this procedure. Can you drink fluids with the solid food, or are you supposed to eat your solids first and then do the liquid?
You're supposed to, ideally, not drink with your foods. What we tell every patient with the band is it works best with solid food.
Okay.
If we tightened it to the point where a glass of water goes down difficultly, then you'll not enjoy that. You'll
Right.
have heartburn and indigestion. So we always say with a band, we want you to eat solids and not so many sliders, and we don't want you sipping with your food. So if you're sipping or drinking with your food, you're turning all your food into sliders. So we want you to have a mental picture of a small portion of dense foods that you don't drink with. So it could be, for example, for breakfast, it'd be better for you to have a little ham and egg and a tiny bit of wheat bagel rather than a yogurt. The yogurt is the slider food. It'll go through without any restriction. You could eat a lot of that. The solid food, you'll feel that good resistance.
Okay, I see what you're saying. So, I mean, you could sit there and eat a gallon of ice cream and that puppy would go down, and then you've got all that high caloric intake.
Right.
So it's better to go with the solid foods where they kind of get stopped up there at the top.
It's not entirely natural. In other words, if I'm not counseling a patient to say, listen, what you want to do is to eat solid foods, feel that fullness.
And then stop, yeah.
If left to their own resources, they'll tend to eat what is more comfortable, because if they throw up once or twice with a chicken sandwich, they'll say, well, I won't do that again.
Mm-hmm.
But what we want them doing is eating foods that do get stuck, avoid sipping, and focus on solids, not sliders.
Okay. Now we're going to go through these 3 procedures and then go back to the pros and cons of each, which I think will be very interesting to hear as well. Okay, another procedure you do is sleeves. Now, how is that different from a lap band?
A sleeve is the newest procedure.
Okay.
And so we have just data with about 5-year follow-up now.
Now, where was that invented? That procedure was here in the States or in Europe?
It was really probably invented in Europe.
In Europe, okay.
More precisely maybe in Germany,
Mm-hmm.
but it started out as the first stage of a 2-stage operation.
Okay.
And in essence, what it does is it creates a tubular stomach or a sleeve rather than a big patulous stomach. So if you think of your large stomach as being like a big water balloon,
Right.
in this case we're stapling it off to turning it into a hose. So it's a narrow tubular stomach, maybe the size of a banana.
So you literally take a stomach that's kind of round, and how do you push it there and then staple it off? How is...
Well, we put a tube down the mouth, and down the inner wall, and then we fire staples up that side of the tube, so it creates a tubular stomach.
That is remarkable. That is remarkable. Okay.
I'm sorry.
No, go ahead, doctor.
Well, one of the ways it works is that it restricts how much you can eat, and the other way is that the hunger hormone that is called ghrelin, but it is secreted largely from that outer stomach.
Interesting. Okay, and again, these staples, what material are these staples made of?
All the staples are made from titanium.
Titanium.
And nowadays in all surgery, lung surgery, abdominal surgery, colon surgery, we all use titanium staples.
One of the strongest, yeah, known to mankind. Okay, and then the other procedure you do is called a revision. I've never heard of this. I've heard of the other top three, but revision, what is that?
A revision is really more of a category for patients who have had some other operation, usually
Hence
some
the word
other
revision,
bariatric
okay.
operation.
So is it almost kind of a fix-it to a procedure that didn't go well?
Right.
So it's termed a revision, okay. And it'll vary from a case-to-case basis, I guess.
Very much varies from case to case.
Okay. Now, having talked about these 4 procedures, why don't we talk about ideal candidates for these bariatric surgeries? Because I know there's some basic criteria, people that are considered morbidly obese, so define what that means.
Okay. Morbidly obese means morbid means disease, so it means that you have diseases associated with obesity.
Interesting. Okay.
Most of us in bariatric surgery think of these operations not as just making somebody thin and
like an
and
aesthetic
happy.
type thing.
Right.
Yeah,
It's not a cosmetic procedure. It is incredibly valuable in terms of addressing all the medical problems associated with obesity.
And why don't we go through some of those factors, because I know things like diabetes and so forth play a critical role.
There are a lot of experts that believe obesity is the leading cause of preventable death. Some people also consider it to be one of the leading causes of cancer, believe it or not.
Really? Obesity, okay.
So the preventable diseases that bariatric surgery corrects includes diabetes, hypertension, cholesterol, sleep apnea, joint disease, gastric reflux, some of the metabolic syndromes that affect hormonal problems. But just picking diabetes alone.
Oh, yeah. People think it's a little sugar disease, and it's devastating, isn't it?
Well, it's the leading cause of blindness, amputations, kidney failure, people on dialysis. So if we have an operation that one of these operations, let's say, can cure the diabetes 95% of the time, usually within a couple of weeks.
Right.
So if that was the only condition it treated and cured, didn't even lose weight, it would still be considered one of the most powerful procedures, yes.
Absolutely. Dr. Kuhn, we got to go to break here in just a moment, but when we come back, another term that many of us are familiar with, body mass index, and I want to talk how you determine that with your patients.
Okay.
Folks, I'm here with Dr. Joseph Kuhn, and we're talking about the bariatric surgery procedures here. He is attending physician with Medical City Dallas. We will be back in just a moment. Eat healthy.